We're going over to Scotland now to speak to Dr. Mark Skimming. He's a dentist based in Dentistry on the Square in Glasgow, and he's written a book called Why I Now Love My Dentist More Than My Valentine's Chocolates. How fabulous is that? There was a great article in the Daily Mail earlier this week with the headline, How to Beat Fear of the Dentist. Apparently 40% of us are afraid of going to the dentist. Good morning, Mark.
Good morning, Hannah.
Hi, thanks very much for being with us. How does it feel knowing that 40% of the UK are afraid of you?
Yeah, I mean that's something that's a kind of legacy that's left from dentistry. You know, before I was born, and my parents tell the stories of going to school dentists and the way that they were treated and how things went around at those times. You would never speak to the dentist. You would never question what they were doing to you. So understandably, that's the way things are at the moment, and we're still, feeding off that legacy. And you know, the whole profession wants to do something about that, but I feel that we do something quite individualised and something that's not taught at dental school in my practices. So I decided to put it in the book.
Yeah. So why is it, do you think, then, that a lot of people are, a lot of younger people, let's say, are afraid of the dentist? Because if older people are, as you say, it will often come from previous experience. But younger people seem to be afraid of going to the dentist as well.
Yeah, a lot of it feeds off. Well, there's a number of reasons. A lot of it feeds off if they go to the dentist with an anxious parent. They see that anxiety from the children. Immediately becomes anxiety. It becomes anxious. We see it all the time when parents bring their kids in, and the first thing they say when they want to put them in the dental chair is, "Don't worry, it won't be sore," or "You need to be brave." So automatically, a young child is expecting something untoward to happen to them. Also, with the kind of history of bad dental health that the UK typically has had, although in the last 10 years we've made drastic improvements. When you have bad dentistry or bad dental health as a child, you need a lot of treatment as a child. Now, you don't really have the coping mechanisms and understanding as a kid to be able to manage with that. So it tends to be those who have had a phobia or currently have a phobia have had a lot of dentistry, and particularly a general anaesthetic when they're a child to have teeth removed.
Yeah.
It's not a pleasant experience and will stay with you in your adult life.
And with regards to how the kind of treatment that a lot of people end up getting, or the difference in treatment. I mean, I have friends, for example, who don't have any fillings at all, who are in their 40s, they haven't got any fillings, and they say, well, I've always looked after my teeth. And then I have friends of the same age who have loads of fillings, who also say they looked after their teeth. They've always brushed their teeth 2 or 3 times a day sometimes, but yet they've had to go to the dentist a lot and have lots of fillings. Is it always your fault through not looking after your teeth enough, or can there be other reasons?
It's primarily, I mean, I don't think it's good to point the finger at anybody. It's primarily, preventable disease. Almost every part of dentistry in terms of the disease factors is preventable. So tooth decay is purely born out of sugar and the consumption of sugar. Now, it's not purely black and white, because a lot of people will say, well, I don't have much sugar in my diet, but it tends to be things in diet that's hidden sugars, things like yogurt. So, a lot of people assume that that's a healthy snack, but a lot of these are loaded with sugar, and there are various examples of that on the food market. Sugar is the cause of tooth decay. Now, that can be minimised with fluoride. So brushing your teeth will reduce the chances of getting decay, but it doesn't stop it. If you brush your teeth 10 times a day, and you have sugar in your diet, you will still end up with some decay in some areas. And the same applies to gum disease. A lot of people can take fantastic care of their teeth, but if they have a complicating factor, something like they smoke, and even some very unfortunate people who have kind of a genetic predisposition to gum disease, then they can have these problems, whereas somebody who has none of those factors doesn't clean quite as well, but they don't get the disease because they don't have these complicating factors can arise. But we have to make it clear, and as dentists, this is what we all try to put forward to the government, is it's 100% preventable disease. So dentists want to work in a preventable manner, but unfortunately, the government through the NHS and some of the private schemes, they don't really focus on prevention as much as we would like.
Yes. So with regards to being at the dentist and the kind of things that people generally don't like, I suppose injections is one of the things. Some people don't like injections or needles in any part of the body, but I suppose in the mouth particularly it's a sort of daunting experience. What can people do about that?
Well, obviously having an injection in the mouth, it's kind of an invasion of personal space and the injection at the same time. So there are a number of things that we do and a number of things that are detailed in the book. Now, we're not saying that you won't feel nervous coming for your appointment, but what we will do at the initial exam is explain what's going to happen. So we use warm anaesthetic, so it's warm to body temperature, so you don't feel this cold anaesthetic going in. And we use a numbing gel and leave that on for 2 minutes before the injection occurs. We also use a digital injection system, so what would typically be the painful point of an injection would be the dentist pushing the injection liquid in to the gum. Now, if that goes in fast or even just at a kind of moderate rate, that can be particularly painful. So if we have it digitised, and the digital systems that we use have a feedback sensor to make sure that pressure isn't going over a certain threshold, then the digital system will control how quickly the liquid goes in. Now, that might make it a couple of minutes longer to put the injection in, but whilst it's going in, it's painless.
Okay. And can you ask for those things as a patient then?
You can. It tends to be, that it would be practices that are maybe a bit more forward-thinking in the equipment that they've bought, and maybe, the kind of experiences they want the people who visit them to have. So, you can, call up your practices and ask them, do you use this? Or, ask the dentist, how good is your injection? Do you put it in very, very slowly? Because some dentists that I learn from, they don't use digital injection systems. They can do it by hand. But we found through our experiences, the way to get it right every single time was to use the digital systems.
And what about drilling? I suppose that's another thing. Even the word of it, the idea of somebody somebody drilling into your body, into your mouth, is a weird thing to kind of get your head around. Obviously, if you've had an injection, which most people will have done before they have any drilling done, then theoretically you shouldn't feel anything. But if you do, again, what can be done? Should you have a further injection, or are there other things that can be assist?
Well, with the drilling, I mean, the high-speed drill that we use is particularly detested by the public that come and see us. And there's a number of factors in that. One of the main reasons is the noise that it gives off. It's really kind of high-pitched squeal, which is, a very unpleasant sound at the best of times. Never mind when you're feeling nervous about having some work to be carried out. So, the things that we do with that, we use noise-cancelling headphones so you don't hear the noise. We have a Spotify playlist for some of our patients to have them nice and relaxed. We make sure that you're nice and numb. The digital systems that we use check that you're nice and numb beforehand, so you're not feeling any drilling being carried out. The vibration from the drill can sometimes be felt, in which case, if I do have someone who is particularly nervous about that, there is some machinery such as lasers and air abrasion systems that can avoid the use of the drill in a lot of instances, and they work particularly well where you don't have these sensations of vibration and the high-pitched noise kind of whizzing through your head.
And what about the pain afterwards, after you've got home and the what's it called? The injection has worn off. If you're in a bit of pain, then should you automatically be on antibiotics, or are there other things that you can do?
No, that's a very common question. We've always tried to make it clear that an antibiotic will never do anything regarding pain. If you do have some post-op sensitivity, the best thing is for a dentist to explain beforehand what to expect. So that you're fully clear, and so that, because one of the worst things is the worry after it. Well, I wasn't explained that I might experience some of this, so I tend to worry. So if you do experience anything, the best thing is just, calmly contact your dentist again, explain what's going on, and they'll be more than helpful in getting back to you and explaining what may be the cause. I mean, we can carry out a lot of work. I personally do a lot of implants and a lot of surgery, and people always expect I'm going to be very, very sore after this. It's going to be weeks and weeks of pain, but when they see the testimonials that people have written, and then once they've experienced it themselves, they come back to you and said, after surgery, I've had a bit of mild discomfort, but some paracetamol or ibuprofen, and I've been absolutely fine. Yeah. And that's the kind of typical way, and it's because they have an expectation and they're told how to manage things.
Yeah.
One of the things that we see every now and again is some sensitivity after a filling has been done, and it tends to be that some of the decay that's been in the tooth has irritated the nerve a little, and then cleaning it out it's just irritated a little bit more, and that tends to be quite self-limiting. Just avoid hot and cold things.
Right.
And that tends to be able to calm down on its own. But if it doesn't die down within a couple of days, at no point should you ever be kept awake at night or have to take any painkillers. If that's the case, then always please go back and visit your dentist,
okay.
because there may have been some irreversible damage done by the decay. Right. Okay. In the first place, it's just been lingering there quietly.
And as long as people aren't having issues with their teeth, obviously if you're in pain you should book an appointment with the dentist, but if everything seemingly is fine, how often should people be going to see the dentist?
You should be going every 6 months, the reason being that we can't tell, individuals can't tell about dental disease until it's at its very latest stages, when things are really too far gone. So in Glasgow, unfortunately, historically there hasn't been great access and great education about dental care. When somebody comes in pain, it tends to be that the decay is so deep in a tooth that it's now affecting the nerve, whereas if they were seen sometime before, it'd probably just be a small filling that is carried out. And the same goes for gum disease. If your teeth are starting to become mobile and a bit wobbly in there, then it tends to mean that the gum disease is quite advanced.
Right.
So always the case that go in, expect regular checkups every 6 months, expect visits with a hygienist every 6 months, and if your dentist feels that you're fit and you're dentally well and you don't need to be seen as often as then they'll inform you of that.
Yeah. Okay. Fair enough. And do you enjoy your job?
I do. I mean, like any job, it has its challenges. It's very rewarding when we have, every day we have people giving us hugs and thank yous, and the whole team take real enjoyment and seeing the testimonials on my website. They have loads of video testimonials, and people always tell the story of what we do better than we ever will.
Yeah.
So we really appreciate that. Like any job, it can be difficult at times, but we're very driven and very focused on the care that we do. And to be honest, I work in a very kind of passionate profession, who really want to change the outlook that the public have, and certainly the media put against us.
Yes.
There's been a lot of research recently about how safe and how well dentistry is done in the UK. And these are the things and that was done by the CQC. These things are never reported. The nice stories are never reported in the media about anything they can, particularly some papers, sensationalise in the headlines, because it's a very safe, very well carried out profession. It doesn't get done right every time. But that's the same with every profession. But we take a lot of pride in what we do.
Well, I think getting hugs from your patient has to be one of the best testimonials, doesn't it?
Yeah, we all get hugs.
Brilliant, fantastic. Well, if people want to get a copy of your book, it's called Why I Now Love My Dentist More Than My Valentine's Chocolates, and it's by Dr. Mark Skimming, who we've been chatting to today. Mark, thank you so much.